France 24's Doug Herbert's been keeping a close eye on the situation there in the UK. He joins me now on the set. Doug, why is this situation getting worse day by day?
Two major reasons. One, complacency. And the second, misguided and wrong-headed political messaging from the Boris Johnson government. His government, since on so-called Freedom Day in England in July 19th, they lifted nearly all the restrictions. Since then, it's been a free-for-all in Britain, basically, when it comes to the pandemic. And the political message, if it hasn't been explicitly put in these words, has been, pandemic's over. Keep on, carry on with your business. Life is essentially back to normal. And a lot of Britons have sort of responded to that messaging. You go around places in London and beyond, and, pubs are packed. People aren't wearing masks indoors. Unlike a lot of other European countries, including, from Germany to France to Italy to Spain, where the case right now, if we can even bring up the numbers, are more than all those countries combined, the new cases in Britain. Unlike all those countries, there was never a mask mandate for indoors. There's no limits on capacities for cinemas or theaters, no real social distancing to speak of. You could see there almost 50,000 cases. That was on Wednesday, Jeannie. We also, this week on Monday, had about 50,000 cases. Now, look, daily deaths, 179. Any deaths are too much, you could say, with COVID. But thankfully, because of the vaccines, this could have been far more catastrophic. The fact that what Britain's saving grace here has been that it has had vaccines. You'll remember early on it was a trailblazer, excuse me, in rolling out those vaccines. It had a very, very quick start. It was the lead of the pack practically in the world early on, but it's fallen behind again. But because of the vaccines, those deaths, hospitalizations are way down from what they were, say, a year ago when the case numbers were about the same. 73%, almost three-quarters of the population or more, have gotten their first dose. 70% have gotten a second dose. That's obviously helping. It's the new stages now of the vaccines that are proving more tricky for this government because they had success early on. They got a lot of people vaccinated very quickly. That was months ago. Now they're on the booster shot phase, and they're not having as quick an uptake, to put it mildly, whether you're talking about teenagers or the over 80 unvaccinated so far. So the government's calling on them to step forward and get their vaccines. But it boils down to bad messaging, not following the scientific guidance, and even now not really following the pleas, the imploring of doctors and scientists to lay on more restrictions.
Correct. And things like the government not putting in place that mask mandate. What is the government planning on doing about all of this?
What they're planning on doing is not laying on, for now, more restrictions. Exactly what the doctors are begging them for. The people in the NHS, the National Health Service, saying, please, before it's too late, we need to impose measures. We're not talking, Jeannie, about another lockdown. Britain has locked down 3 times. This isn't about forcing people back into their homes. What the doctors are asking for are relatively, at least from the perspective of the European continent, where these measures are sort of taken for granted, we're talking about asking people to wear masks indoors, especially in crowded indoor situations. We're asking them to perhaps have health passports, the way they have in France and a lot of other countries now, where if you want to go to a bar, restaurant, that's fine. Show your health passport. Either show that you have a negative test or that you've been fully vaccinated. Obviously, it's been controversial in many places in Europe, but it's become sort of the normal. And now it is instituted just about everywhere. Britain had plans to introduce a health passport, but they halted their plans to do so. And since then, like I said, it's been really a free-for-all. So their plans right now are to rely on vaccines, getting more people vaccinated more quickly, step up that rollout program of the next phase of vaccines, booster shots, and try to get people to come forward and also rely on some antiviral COVID treatment, actual medicines to help beat COVID if you have it. But it's not enough, and it's not what should be being done according to the doctors. Just relying on vaccines. I mean, vaccines are great. They're a miracle of modern science. They help a lot. But you need the combination of the vaccines and, according to the doctors and the scientists, more restrictions. That might not be a politically popular message, but it's one that they say that even the populist government of Boris Johnson should be falling back on right now, and they should be doing it without any sense of shame, without any sense of remorse.
Doug, thanks for that. France 24's Doug Herbert.